Unlocking the power of calcium and vitamin K2 for heart health. Did you know studies like the Women's Health Initiative showed that taking more than 1 gram of calcium supplements daily increased cardiovascular risk by 15 to 22%? Hey there today. I'm thrilled to dive into a topic that's been a game changer in my cardiology practice: the connection between calcium, vitamin K2, and heart health. If you've ever wondered why calcium seems to clog arteries instead of strengthening bones, or why heart disease often goes hand in hand with osteoporosis, this is for you. I'm here to break it all down in a way that's easy to understand and actionable. Here's the info for you. Before we get started, welcome to the Cardiac Health Crew, where our team of cardiologists and certified hypertension educators shares simple, real-world advice to help you thrive. If you're vibing with this, hit that like button, subscribe, and tap the bell to catch all our updates. Drop a 1 in the comments if you're curious about blood pressure, or a 0 if it's not your thing yet. Your feedback helps us create content you'll love. Your guide to strong bones and clear arteries. It's packed with tips to optimize your calcium and vitamin K2 intake for better heart and bone health. Grab it via the link below this video. Also, if you find this helpful, give this video a thumbs up, share it with your loved ones, and subscribe for more heart health insights. Let's jump in. The calcium conundrum. Why it's not always the hero. Calcium is one of those nutrients we've all been told is essential for strong bones and teeth. Growing up, you probably heard, "Drink your milk for strong bones." But as a cardiology fellow, I started noticing something puzzling. Patients with heart disease, blocked arteries, heart attacks, and strokes often had other issues like osteoporosis, arthritis, diabetes, high blood pressure, and even dental problems. Why were people with weak bones also dealing with clogged arteries? And why were calcium supplements meant to help bones, sometimes making things worse? This question sent me down a research rabbit hole, and what I found was eye-opening. Calcium is critical for your body. It helps build bones, supports muscle function, and even plays a role in blood clotting. But when calcium ends up in the wrong places, like your arteries, it can spell trouble. That's huge. In kidney disease patients, the risk was even higher, up to 22% increased mortality just from calcium supplements with or without vitamin D. This was a wake-up call. If a drug reduced heart risk by 20%, we'd be shouting it from the rooftops. But a supplement increasing risk by that much? It's not getting nearly enough attention. So what's going on? Why are calcium supplements meant to strengthen bones, linked to heart problems? And how does vitamin K2 fit into this puzzle? Let's explore why calcium supplements can backfire. First, let's talk about why calcium supplements might not be the bone-saving miracle we thought. Your body tightly regulates calcium levels in your blood, using hormones, enzymes, and vitamins to decide where calcium goes: bones, teeth, or elsewhere. When you take calcium supplements, especially in high doses, your body might not know what to do with the excess. Here's what can happen: artery calcification. Excess calcium can deposit in your arteries, forming plaques that harden and narrow them, increasing your risk of heart attacks and strokes. Blood clotting. Calcium helps blood clot, which is great if you're bleeding, but not so great if it promotes clots in already narrowed arteries. High blood pressure. Some studies suggest high calcium levels can stiffen blood vessels, raising blood pressure, though this isn't always the case. The kicker? Many people taking calcium supplements for osteoporosis or general health don't actually need them, unless you have a specific deficiency or condition like severe bone loss. Your diet usually provides enough calcium. Over-the-counter calcium pills are easy to grab, but they're not always safe. My advice: don't take calcium supplements unless your doctor recommends them based on blood tests or bone density scans. And even then, there's a better way to manage calcium. Enter vitamin K2. Vitamin K2, the unsung hero of calcium metabolism. So, what's vitamin K2, and why am I so excited about it? Vitamin K2 is a fat-soluble vitamin that's critical for directing calcium where it belongs, into your bones and teeth, and away from your arteries and soft tissues. Unlike vitamin K1, which is all about blood clotting, think leafy greens, vitamin K2 is the key to healthy calcium metabolism. It's like a traffic cop, making sure calcium doesn't cause chaos in your body. Here's how it works. Your body has two key proteins that rely on vitamin K2, osteocalcin, in bones. This protein, produced by osteoblasts, bone-building cells, needs vitamin K2 to activate it. Once activated, osteocalcin grabs calcium from your bloodstream and locks it into your bones, making them strong and dense. Matrix GLA protein in tissues, found in blood vessels and soft tissues. This protein also needs vitamin K2 to activate. When activated, it binds calcium and pulls it out of places it shouldn't be, like your arteries, preventing calcification. Without enough vitamin K2, these proteins stay inactive. Calcium floats around, landing in your arteries, causing plaques, instead of your bones, causing osteoporosis. This explains why heart disease and osteoporosis often go together. Vitamin K2 deficiency could be the missing link. Why are we deficient in vitamin K2? You might be wondering, if vitamin K2 is so important, why are so many people deficient? Great question. It comes down to modern diets and lifestyle changes. Vitamin K2 is fat-soluble, meaning you need dietary fat to absorb it. For decades, low-fat diets were pushed as the gold standard for heart health, but they inadvertently cut out key sources of fat-soluble vitamins like A, D, E, and K2. Here's why we're running low. Dietary shifts. Low-fat diets mean less absorption of vitamin K2, especially if you're avoiding healthy fats like those in eggs or dairy. Poor food quality. Vitamin K2 comes from two main sources: animal products like meat, eggs, and dairy, and fermented foods. But today's factory-farmed animals are often fed grains instead of grass, which lowers the K2 content in their meat and eggs. Similarly, many eggs come from chickens, fed grain-based diets, not the natural K2-rich foods they'd eat in the wild. Decline in fermented foods. Fermented foods like natto, a Japanese soybean dish, sauerkraut, and certain cheeses are rich in vitamin K2, especially the MK7 form, which is longer lasting in your body, but most modern diets lack these foods. Medications. Blood thinners like warfarin, Coumadin, block both vitamin K1 and K2. Long-term use can lead to K2 deficiency, causing calcium to build up in arteries and valves. I've seen this in patients for years. Those on warfarin often have calcified aortas or coronary arteries. The result? Weak bones, osteopenia or osteoporosis, stiff arteries, calcification, and a higher risk of heart disease. It's not that we lack calcium, it's that calcium is in the wrong places. The science behind vitamin K2. The evidence for vitamin K2's role in heart and bone health is compelling. Let's look at some key studies. The Rotterdam study. This large European study followed thousands of people over 55 for 8 years. Those with higher vitamin K2 intake from foods like cheese and fermented products had less aortic calcification, lower rates of coronary artery disease, and reduced all-cause mortality. Consuming just 32 micrograms of K2 daily was linked to a 50% reduction in cardiovascular death and a 25% drop in overall mortality. That's huge. Non-carboxylated proteins. Researchers can measure inactive osteocalcin and matrix GLA protein levels, a sign of K2 deficiency. Higher levels of these inactive proteins correlate with more artery calcification, confirming K2's role in keeping calcium out of blood vessels. Cancer connection. Emerging studies suggest vitamin K2 may reduce the risk of certain cancers, like prostate and liver cancer, by regulating cell growth. While more research is needed, this adds to K2's potential benefits. These findings got my attention as a cardiologist. If a nutrient can cut heart disease risk by half, it's worth shouting about. But here's the catch. We can't easily measure vitamin K2 levels in your blood yet. Tests for non-carboxylated proteins are mostly used in research, not clinics. So we rely on dietary intake and symptoms to gauge deficiency. Where to get vitamin K2? Now that you know why vitamin K2 matters, let's talk about how to get it. There are two main forms of vitamin K2. MK4, found in animal products like grass-fed meat, egg yolks, and butter. It's shorter acting, but still effective. MK7, found in fermented foods like natto, certain cheeses, Gouda, Adam, and sauerkraut. It's longer lasting, staying active in your body for days. Here are the best sources. Fermented foods. Natto is the K2 superstar, with about 1,000 micrograms of MK7 per 100 grams. Other options include fermented veggies, like sauerkraut, and aged cheeses. If you're not a natto fan, it's an acquired taste. Try incorporating small amounts of fermented foods daily. Grass-fed animal products, grass-fed beef, pasture-raised egg yolks, and butter from grass-fed cows are good sources of MK4. The key is grass-fed. Grain-fed animals produce less K2. Dairy, cheeses like Gouda and Brie, and full-fat yogurt from grass-fed cows contain K2. Look for high-quality, minimally processed options. Why is quality so important? Animals fed grass or natural diets convert vitamin K1 from plants into K2, which ends up in their focus on food sources which are safer and better absorbed. Good options include dairy, milk, yogurt, cheese, from grass-fed cows, leafy greens like kale, broccoli, and collards, fortified plant milks, check for added sugars, fish with edible bones like canned sardines or salmon. Most adults need 1,000 to 1,200 milligrams of calcium daily, but you can meet this through a balanced diet without supplements. Pair calcium-rich foods with K2 sources to ensure proper metabolism. For example, have yogurt with sauerkraut or salmon with kale. If you're on warfarin or other blood thinners, talk to your doctor before increasing K2 intake, as it can affect your medication's effectiveness. Similarly, if you have kidney disease or a history of kidney stones, calcium intake needs careful monitoring. Always work with your healthcare team to tailor these changes to your needs. Lifestyle matters. Vitamin K2 is a powerful tool, but it's not a magic bullet. To keep your heart and bones strong, combine K2-rich foods with other heart-healthy habits. Exercise. Weight-bearing activities like walking or strength training build bone density and support heart health. Manage blood sugar and blood pressure. Diabetes and hypertension increase artery calcification risk, so keep them in check with diet and meds if needed. Avoid smoking. Smoking weakens bones and damages blood vessels. Limit processed foods. High sugar, high sodium diets contribute to inflammation and heart disease. For more on blood pressure, check out my video 10 Causes of High Blood Pressure You Need to Know after this one. A free resource to get you started. I hope you're as excited about vitamin K2 as I am. To help you put this into action, if you found this video helpful, please like it. Share it with someone who needs to hear this and subscribe for more heart health tips. Calcium and vitamin K2 are a dynamic duo for keeping your bones strong and arteries clear. You have the power to take charge of your health, one bite at a time. So live your healthiest and happiest life. See you in the next video.